Okay, so today we are going to be talking about bulging disc. And here's a few of the things about bulging disc. First of all, a lot of times people will call these slipped disc. Discs do not slip. You have your disc in your back. And by the way, and these are the notes for this section. So discs do not slip. They tear, they break open. A lot of people say, imagine a jelly donut with the jelly inside, and you squeeze it, and then the jelly kind of pushes against one side, causing a bulge. Okay, and it can be due to a herniated disc. That's kind of what I just described. Discs are supposed to bulge. That's their job. They act, like I mentioned before, they act like a big shock absorber. Many people have bulging disc. Most people have bulging disc. Okay, because like I said, they're supposed to be like shock absorbers. So it's not uncommon for them to bulge. And as you get older, they may continue to bulge. Okay, herniated disc is when the inside tears, and I'm going to show you pics on this, but the inside tears and it causes a bulging of the disc. And a lot of times, even that's not a problem unless it starts to put pressure on a nerve. And like it says here, so when they put pressure on nerves, that's when they become a problem. Okay, a herniated disc, the pain will radiate down below the knee. This is in the low back. You can get herniated disc anywhere in your spine. The most common place is at the very low back because of the bending and twisting people do. It can cause the disc to tear, which will lead to a bulge. Wayne Gretzky, the great hockey player, who most people probably never even heard of, greatest hockey player of all time, actually had a disc herniation in the middle of his back, which is extremely rare. And then it's not uncommon also, not as common as the low back, but it's not as common also to herniate the disc in the neck. And in that case, sometimes you're going to get pain going down into the arms. So let's take a look at disc. So we've gone through this before, and what we're looking at here is actually the low back. All right, this is your low back. And I'm just going to bring in my screen a little bit. Okay, and this is the low back and the neck. Okay, so let me get my pen. So what we're looking at here is just the low back. This is the very, very bottom that's down here. And like I pointed out on the fracture video, these are your disc that are right in this area here. So as you go down the spine, they actually start to get bigger, these discs. All right, and this is the way they look. If you notice also, the spine has a curve. That curve also acts like a shock absorber. But looking from the side, here's the disc again. It's these. And then where you see the numbers, these are bones. So you could say what's right here, this disc is the L4, L5 disc right here. And I don't know if I can draw L4, L5 disc. The most common one to get herniated is either this one or especially this one. This is called the L5S1 disc. Okay? And the reason for that, this is the sacrum right here, your tailbone. I also want you to notice right here how big these openings are. Right here. So what happens is your spinal cord is actually inside here, and you get nerves that come out through here. So when a disc herniates, what it can do is actually push back this way. Let me switch colors here. It can actually push back this way into this area in here and put pressure on the nerves that are back in there. Okay. Oh, looking over here now, this is looking at the neck from the side. By the way, and this was the low back from the side. This is looking at the low back from straight forward. So this is looking at the low back from the side. You also have little openings back in here also. They're a little harder to see just because of the fact that you have transverse processes sticking out towards you. But if we look, here's my cervical disc again. Right here and right here. Okay, so those are my cervical disc again. All right, and so let's go ahead and take a look now about what happens here with my cervical or with my disc. So as you see here, this is a normal disc right here. This is looking from the top down. Okay, a minute ago we were looking from the side. This is looking from the top down. And so here's my disc. And if you notice here, it says nucleus propulsus. And so what happens with the nucleus propulsus is it's a gel-like substance on the inside. The disc annulus goes around the outside. This would be the back. This is posterior here. And let me switch my color here. So this is posterior here. Okay, this would be the front. That's up in here. So imagine this is someone's stomach right here. Okay, and this is the spinal cord, like it says. You have spinal nerves coming off of here. So like we said, when you get a herniated disc, okay, and a bulging disc, what's going to happen is this is just going to wear out, and sometimes people get little bulges on the disc. When you get a herniated disc, these fibers, the disc annulus tears, and that's what you're seeing here is this is a tear. And so now what's happening is that gel-like substance is starting to come out, and as you can see, it's putting pressure on the nerves right here. And when it puts pressure on those nerves, it's going to cause pain to go down either into the arm or leg. I don't know where this is at in the body. Actually, this is like it's more in the lumbar spine, but anyways, the low back. So anyways, that's what's going to happen in a herniated disc. So let's erase this real quick. All right, and then if we look now, this is the bulge looking at it from the side. So this would be looking from the top. Okay, and even though this is the low back, the next one just gives you kind of an idea. This looks like it's actually in the neck. Okay, and there's my herniated disc now, pushing out that way. All right, that's my herniated disc. So this is what it looks like from the side, once again, and this is what it would look like from the top. So let's go on. And then sometimes what can happen is if you look at the MRI here, you can see that we have a herniated disc going back into the spinal cord right here. Remember we talked about the spinal cord when we were going over the fractures? So here's my spinal cord again. Here's my spinal cord. Here's my spinal cord, but you can see this disc has herniated and it's pushing way back here on the spinal cord right here. So they've gone in and straightened it out. If you notice right here, what they do on this is they actually take a piece of bone from your hip and they take the disc out. So they remove this disc here and they're going to remove all this here so it's no longer on the spinal cord. They take a piece of bone out from your low back, from your hip, and they put it in here and they let it grow. And if you notice, this is metal here. These are basically screws that are in there. And then eventually this whole thing just becomes one big piece of bone. So you do lose some of the shock absorbing effect, but this is actually a pretty decent surgery. It has, people feel pretty good after this if they've been suffering from herniated disc and stuff like that. So anyways, let's go on and take another look. This is just to give you an idea of what happens in the low back. Let me move this over just a little bit so you can see more. This is the spinal cord. All right, and then you can see we have the dorsal root here. So once again, what's going to happen is if I get a herniated disc and it's going to put pressure onto this nerve right here, I am going to get pain that's going down the leg or going into the arms. Okay. Normally, you don't get a herniation that's going to put pressure right here. I imagine it's possible. I've never heard of it. But I guess it could happen. Okay. Normally, it's going to be towards the back, and it's going to put pressure on here, and then it's going to cause pain to go down into the legs. If that happens there. Okay. And then this is just to give you an idea now where the nerves go. So if you look, the nerves are going out through the body all over the place. And so you can see, depending on where the herniation is, especially if it's down here in the low back, what's going to happen is it's going to go down into the leg. If it's up in here, in the cervical and spine, it's going to go down to the arms. So that's basically it for disc herniations. The next video, what we'll talk about is how we diagnose these orthopedic or neurological testing for disc herniations.